healthy. What has been the roles of the sanitation efforts? I'd like to ask DDG Liu Lifeng to take the question. Thank you for your question. During the crucial moments of COVID-19 response, sanitation workers have carried out two major work. Apart from the regular sanitation, they also carry out disinfection and decontamination. They've also taken response to emergency, including the disinfection, the sanitation of the mass quarantine, and the detoxification of medical waste. Their work burden was almost doubled, but most of the sanitation workers have overcome the difficulties and achieved the targets excellently, and they have won high acclaim from all stakeholders. In light of the situation changes, the garbage treatment workload has seen some increase, so we've asked the local authorities to conduct a good job in two following aspects. First, we need to carry out consistent efforts. Do not slacken our efforts and consistently ensure the work procedures that are in compliance with the prevention and control standards. From the perspective of sanitation work, we need to consolidate the hard-won achievements in COVID-19 response. At the same time, we should have a good work scheduling to ensure rotation to be off duty by sanitation workers and provide more support to sanitation workers to deal with their actual difficulties. The Wuhan city had 37,000 sanitation workers. Many in law enforcement staff and volunteers have been engaged, and now with the participation of other stakeholders, 20,000 plus sanitation workers are still working in Wuhan. Next question, please. With China Daily, it is learned that China is establishing some pilot cities for patriotic health city demos. So what is the definition of such cities? I'd like to ask DDG Zhou Zhiqiang to take the question. These pilot cities have been one of the reform measures to implement the emphasis from President Xi Jinping. These cities follow new development concepts, foster green way of life, and reduce the solid wastes, reduce the amount of incineration, and ensure recycled economy. We have the following 5 aspects to this pilot concept. First, the adoption of new concept, the no waste, zero waste city, zero waste parks, and guide the general public to practice a concept of a conservation, low carbon and green life. Second, we need to implement the opinions for the treatment of plastic waste, reduce and in some cases forbidden the use of disposable plastic lunch boxes, meal boxes, expand the scope of application for the degradable plastic products. And third, apply the use of environmental friendly delivery packages. Fourth, comprehensive use of wastes and recycling. Fifth, improve mobilization, dissemination, mobilize the engagement of multiple stakeholders so nobody is standing by and everyone is engaged in the practice of a green way of life. Everyone can be a contributor. Now we have 11 pilot no waste or zero waste cities. Over the past year, the zero waste city has been recognized by many provinces. In Zhejiang province, all the cities in the province will be engaged in the zero waste campaign. Thank you. Next question, this journalist from the 5th row on the left side. Thank you. Hong Kong, China Review. The promotion of a patriotic health campaign will have a higher requirement on grassroots level administration. How can we ensure patriotic health campaign can be carried out at the grassroots level solidly? I'd like to ask DG Mao Chuan to take the question. Patriotic health campaign, as we all know, it is a very pragmatic effort. It must be combined with grassroots level efforts by mobilizing the engagement of the general public. In the response to the COVID-19, many localities have been integrating the campaign into grassroots level administration. Great explorations have been carried out. We have with us Beijing governmental spokesperson to share with us Beijing practices later. Localities have been giving play to the role of grassroots level institutions. The party members have been playing a demo role during the weekend cleaning, the clean day during the week.
We also know that, like in Pingdingshan City, Henan Province, apart from organizing the government officials at different levels, the volunteers have also been brought into play and make the health network even more developed and connected. In Ordos, in the Mongolia Autonomous Region, the volunteer teams are also mobilized to be engaged in the patriotic health campaign, in particular the family tutors and the female who have been engaged in household chores. So in Wuhan, there are also similar initiatives where people are engaged to promote knowledge about pest control and in particular the mouse control, and also to clear the environmental wastes and ensure a clean environment. We are going to summarize the practices across the country and summarize them as the best practices, promote them throughout the country, and promote the innovation in this regard. Okay, let's continue. On the left, on the second row, the third gentleman reporter, please. Thank you. With Farmers Daily, the Patriotic Health Campaign is a major initiative and also a successful practice by engaging the general public. My question is for Beijing. How is Beijing conducting this patriotic health campaign in the context of the pandemic? We will have Mr. Gao Xiaojun to take your question. Thank you very much for your concern about the patriotic health campaign in Beijing. In our municipality, following President Xi Jinping's guidance to implement the patriotic health campaign and have a sound pandemic control, we have focused on the following three aspects in this year's Patriotic Health Campaign month. The first is, as this is the 32nd Patriotic Health Campaign month in the country, we have identified and developed 13 video clips and 14 slogans for this year's Patriotic Health Campaign month, and we've also distributed more than 1 million promotion materials and took advantage of various occasions to advocate and emphasize the importance of patriotic health campaigns. We have advocated the relevant knowledge and the integration of such events with the pandemic containment. People are broadly mobilized to be engaged in such campaign activities. Secondly, we have engaged the various stakeholders to set up a joint governance. More than 7,000 public health committees at different levels in the municipality, together with the government agencies, are all mobilized to clean the public environment and eliminate the potential risk of disease spread. Since the start of the Lunar New Year, we've already cleaned about 200,000 tons of sewage and 177,000 sites of potential risks, and also we have disseminated 28 tons of pest or rat control pesticides. Thirdly, we have engaged the general public for the Patriotic health campaign. As you know, in Beijing, we do have some highlights in this regard. For example, the household keeper in Dongcheng and the old neighbors in Shijingshan. They are indeed the highlights of the public involvement in the health campaigns. We have brought into play the role of the volunteers and the Communist Party members. During the pandemic containment, 1.4 million person times have been engaged in the pandemic containment, as well as the health knowledge promotion activities. Also, we have encouraged people to take part in the community-based health activities and promoted the community management, the general public's activities, and pandemic control integration. Such integration activities are conducted to guard against the potential spread of the disease. Okay, let's continue. On the right, on the fourth row, the First Lady reporter, please. Thank you. With NTV, the environmental improvement in rural areas is not only about environmental treatment, but also about other aspects of people's lives in rural areas. So it is quite inclusive and has a major bearing on people's health in rural areas. So what are the systemic considerations of Ministry of Agriculture and Rural Affairs in this regard? We will have DDG He Bing to take your question. Thank you for your question. The improvement of the living environment in rural areas is not only about the rural areas, but also about people's health in rural areas, and also the pandemic control in the current context. The Ministry of Agriculture and Rural Affairs has earnestly implemented President Xi Jinping's guidance together with our sister agencies. We have started from pandemic control and implemented the relevant policy measures. We hope that by the end of the year, we can accomplish the work plan targets. The first is, as you can see, we've already identified 50 measures covering 21 government agencies. In this regard, we've also conducted video conferences and coordinated the relevant agencies. We are guiding the localities to push forward the work resumption and life resumption. Secondly, we have strengthened support. This year, the central budget allocates more than 10 billion RMB yuan to improve the toilets in rural areas and also the living environment in rural areas. Also, for areas that have done a good job last year, they will be provided with incentives to do better. For the next step, we will continue to develop work plans raise funds and make investment or make input in this regard. Thirdly, we are going to further correct the weak links and rectify the problems. In mid-March, 6 ministries and agencies jointly issued a policy circular requiring the localities to rectify the problems and strengthen the efforts. Not long ago, we set up the online platform to engage the whole society to oversee the environment in rural areas. We will also urge the localities to set up good examples and learn from these good examples. Also, the complaints should be handled properly to address people's concerns.
Third, we've innovated the way to provide technical guidance. We've put up some pictures and online consultancy from experts. We've also organized the design and implementation of certain criteria and standards for rural sanitation, and which is in the vetting process. Fifth, we will guide the general public to change their mindset, which is vital in improving the sanitation of rural areas. We will use various ways for the dissemination by publishing books and providing some cartoons, by putting up some videos on the CCTV or news channels. We've also rewarded 166 pilot and leading sanitation villages, and all these has proven effective. We will continue with such efforts. In particular, we will leverage the media role at the grassroots level to ensure the entire society is engaged in improving the sanitation in rural areas. Journalist from the third row on the right side, please. With China Education TV, the medical waste treatment and disposal has a close bearing on the prevention of the second wave of transmission. We'd like to learn about the status quo of medical waste treatment. I'd like to ask DDG Zhou Zhiqiang to take the question. Thank you for your concern in the treatment of medical waste, solid and liquid. In recent days, we have seen positive trend in the control of COVID-19. Proper disposal of medical waste constitutes an important part and parcel of our campaign against the epidemic. MOEE has been implementing President Xi's guidance. We have been implementing 100% of medical institutions, medical facilities are covered. The 100% of the medical waste have been effectively collected and treated. We slack no effort and keep unrelenting focus on the treatment. Up till now, the wastewater treatment has been smooth. There has been no incidents that the failure in the treatment of medical waste caused any problem. All those that should be collected have been collected and treated. As of April the 10th, disposable capacity was 6,700 tons per day, an increase of 23.9% over that before the epidemic. We have collected 37 million tons and above medical waste, and 80% and above are related to the COVID-19. Some of the treatment may take place on the second day. COVID-19 related medical waste, all of them have been timely disposed or transferred. Since 20th of February, the country has disposed a total of 200,000 tons and above. The per-day treatment of medical waste decreased from 247 tons to the current 117 tons per day in Wuhan. The city sewage water treatment plants have been implementing the decontamination detoxification measures smoothly. Pandemic is raging in the world. There is a mounting risk of imported cases. MOEE will continue to closely watch the import risks and the risks in Wuhan and other cities. Pay special attention to ensure that we can cover the entire monitored scope and ensure the collection of all and treatment of all. Thank you. Next question, please. Thank you. National Business Daily. Environmental quality has a close bearing on healthy life. April is the 42nd Patriotic Health Month. Compared with the previous years and the months, what is new and unique for this year's Patriotic Health Month? DG Mao Qun'an is taking the question. Since 1989, the April of each year has been designated as the Patriotic Health Month. Spring marks a good beginning of the year. It is the time for planning. This year's Patriotic Health campaign is designed different from previous years. The history of Patriotic Health campaign has been emphasized, in particular the patriotism spirit. It is a social responsibility of each Chinese citizen. It is the basis where solidarity can fight against a major battle, which has been reflected and exemplified by our response to COVID-19. Second, sanitation improvement has been focusing on prevention of infectious diseases. We emphasize the key places, organizations, communities, villages, stations, docks, and pay special attention to the weaknesses in the old and dilapidated communities, the fresh markets, and the smaller catering businesses. Also, we need to look at different infectious disease patterns in southern or the northern China to organize different vector-borne disease prevention control efforts. Third feature for this year's campaign and month is that we focused on some questions of profound concern by the general public, including the more harmonious psychological understanding and the health tips and popular sciences. The Patriotic Health Campaign Office, MOHERD, Ministry of Agriculture, and National Health Commission, China Trade Union, the Communist League, and also the Women Federation. Altogether, 9 ministries and departments have been engaged. Each department has designed some thematic programs. We also hope the friends of the media can give enough coverage of all these thematic campaigns carried out by different ministries. We hope that we can mobilize the engagement of a more general public into our campaign. Thank you. Next question, please, journalist from the third row on the left side. Thank you. With Cover News, I have a question for MOHERD. DDG Liu was mentioned that during the most crucial moment, the sanitation workers' workload was almost double that of the regular times. What about the situation now? I'd like to ask DDG Liu Lifeng to take the question. Thank you for your question. As the COVID-19 response has been towards the positive, the work focus and workload of the sanitation workers have changed. In health institutions, the disinfection sanitation workload has decreased, and there has been a decrease of the needed garbage to be treated. However, with the resumption of business, garbage from office towers and the communities have seen some increase, basically the same level as that of previous years. During previous days, the daily garbage from communities and office towers was around 5,000 tons, but now it came back to 9,000 tons and above. So we have rescheduled the sanitation workload. We will continue to improve the sanitation in the public places, in particular the shopping malls, transportation hubs, and other places with crowds. Second, we will continue to ensure the full cycle treatment, including the daily collection must be treated daily. Continue to focus on the collection and disposal of the wasted masks. Third, we have ensured rigorous standards in the management of incineration places and landfill places. In accordance with the guidelines, will also ensure good management of the public toilets.
Let's continue. On the left, on the fourth row, the lady reporter, please. Thank you. With Xinmin Evening News, we know that classification of the garbage has become the new fad in urban lives. Some communities have had the closed-loop management, and then the community workers are also busily engaged in pandemic control. So will this affect the classification of the household wastes? And what about the current progress with household waste classification? Now we continue to have Mr. Liu Lifeng to take the question. Thank you for your question. Indeed, the classification of the wastes is an important component of improving people's living environment. President Xi Jinping and the central government have been active promoting the classification of the household wastes. By the end of 2019, the 46 key cities have already realized 70% coverage in terms of the household waste classification. In Guangdong, Zhejiang, and Shanxi provinces, the whole provinces have been engaged in the promotion of waste classification. So this has already become a new fad in people's lifestyle. For the classification, the priority is in the communities. Now, with the pandemic control, the community has mobilized the community workers as well as the residents of the communities to be engaged in the public efforts against the pandemic. And indeed, there's some negative impact caused by the pandemic. As you have mentioned, in the collection of the household waste and classification of the wastes, there might be some disturbing results. However, as far as we know, in localities like Shanghai and Hangzhou, with early initiation, the communities can continue to practice the household waste classification, and the end treatment data in Shanghai also indicates that it is consistent with the previous requirement, and the amount of the waste classified is up to the expectation and consistent with the plan. Last week, we have also worked out specific countermeasures against the pandemic, and we try to realize this year's target, and the localities have strengthened their efforts. For example, yesterday, Suzhou had a workshop. The heads of the government attended the workshop, and we are confident to overcome the negative impact caused by the pandemic. Okay, let's continue. On the left, on the fifth row, the first gentleman reporter, please. Thank you. With China Family News, recently, localities have launched the Patriotic Health campaign activities, and Beijing has elaborated on its activities. What about the focus of the Patriotic Health Campaign in the next stage, and what are the highlights of the Patriotic Health Campaign? We will have DG Mao to take your question. Thank you for your question. Indeed, just as you have mentioned, in the pandemic control in municipalities like Beijing and Shanghai, Patriotic Health Campaign activities with specific features have already been conducted in Beijing and Shanghai. Let me share with you some of the features that they have engaged. For example, in Hubei province, guided by the central leadership team, the Patriotic Health Campaign have been well integrated with the pandemic control. For communities, they can conduct such activities to apply for the Beautiful Environment Award for their communities. And also we have created synergy in the society. In Zhejiang province, companies were receiving the special dispatched experts from the governments to help them to improve the environment. In Jiangxi province, the environmental improvement has been identified as a performance indicator in the local government's officials' performance, and has also become an important part of the requests or the criteria for healthy cities and healthy province. In Jiangsu province, the local standards concerning the healthy lifestyle and health dining have been worked out. Meal sharing has already accumulated a lot of good experience and practice. May I take the opportunity and introduce to you these good practices in the local cities and localities. For the next step, we will continue to organize relevant activities, guide the localities to implement the policy guidance, and consolidate the achievements made in pandemic control. Also, we will work in a timely manner to summarize the good practices. For example, for meal sharing, I know people are quite interested in it, and we will upgrade the practice into a sound and healthy practice. So we will constantly enrich the content of Patriotic Health Campaign in the new era and contribute to people's health. The Patriotic Health Campaign is a mass campaign, and we wish to get the support from the media. The journalist putting forward the question is from the China Family News. I'm also very interested in the media campaigns that you are launched in this regard, and I do hope that we can work together and integrate the local practices into the national events and activities. Okay, let's continue. On the right, on the fourth row, the third lady reporter, please. Thank you. With China Rural Magazine, toilets are of critical importance to people's health. They are also important parts of the Patriotic Health Campaign. May I know the specific measures which would be adopted by the Ministry of Rural Affairs to promote the sanitation in rural areas? Toilet revolution has been an important part of the rural environment improvement. Toilets are not just about the environment or the infrastructure. They are also about people's lifestyle and the changing mindset and life habits. So the toilet improvement has become an important part of the Patriotic Health Campaign in rural areas. Over the past couple of years, together with NHC and the relevant government agencies, my ministry has been actively engaged in the toilet revolution. According to data we have, the improved toilet has been available in over 60% of the rural areas in China. For the next step, we will focus on the following efforts. First, we will have specific targets in the light of local conditions. For different regions and areas, they will have tailor-made targets and measures. Our objective is that by the end of this year, we will improve the toilets and make them sound toilets. And secondly, we will help the localities to pick up the appropriate activities and practices, and also to improve the treatment of the wastes from the toilets and also from the household wastes. For untreated waste or waste that has not been soundly managed, they should not be put back into the field.
We should also explore a market-oriented service mechanism to ensure public toilets in rural areas can be maintained and can be regularly ensured that the septic tank can be cleaned. Once problems have been identified, there should be a clear standard to follow in the maintenance. Quality standard must be followed, and each household will be satisfied with the improvement. Meanwhile, on this very topic, we should also guide the general public in rural areas to change their mindset. Effective dissemination that can be understood by the general public in rural areas can ensure good habits and ensure good personal hygiene, advocate good personal hygiene habits, ensure good habit in the using of public toilets. In the interest of time, we can take two last questions. Journalist from the fifth row on the right side, please. Thank you. With the Shenzhen Special Economic Zone news, in context of the current situation, the prevention and control of COVID-19 has become a daily routine. The dissemination achievements carried out ensured by sanitation workers need to be sustained. How should we sustain the achievements? DDG Liu Lifeng is taking the question. Sanitation industry takes up the important responsibility of city landscape and city sanitation. It is an important component in the COVID-19 response. Therefore, sanitation workers have taken up a heavy workload in the COVID-19 response, and they have done a great job. There has been some focus changes. On one hand, we continue to ensure a good job in the prevention control of the transmission risk. Meanwhile, we'll continue to do a good job in the daily treatment of the garbages. We are, as the MOHUD is a member agency of the Patriotic Health Campaign Committee. The city sewage, industry sewage treatment, and also the rural area sanitation efforts are partly carried out by us as well after the outbreak of the COVID-19. Such efforts have been continued. Meanwhile, we are conducting the efforts to ensure the normal life and work. 600,000 city order maintenance staff and also the tens of thousands of sanitation workers have been carrying out efforts in dissemination and sanitation of the mass quarantine. The property management staff and the city order enforcement staff have been carrying out similar efforts as well. 2 million plus sanitation workers in the country have ensured the proper running of the water utilities, the natural gas utilities, and the sewage water plants. All these ordinary sanitation workers have been the important practitioners of ensuring the sanitation of our cities, and they have taken up their responsibility, contributed a valuable part to the maintenance of clean cities even during the COVID-19 response. Last question for the day. Thank you. With people.org to ensure the life and health of 1.4 billion Chinese people, we need not only the medical prescriptions but also a social prescription. We've noticed that the maintenance of city sanitation and personal hygiene have contributed to our initial success, and there has been a long run. During the COVID-19 response, it has dawned on us that there should be some good health habits we should persist with. Which are those habits? DG Mao Chuan is taking the question. It is fair to say that the COVID-19 has run the alarm for us. It has given us a lesson. The personal hygiene, the family or household health are also lens through which we can look at health and responsibility. The COVID-19 response has alerted us that we need to pay attention to the awareness in infectious disease prevention. We need to have a good preventative habit. During the COVID-19 response, each and every of us should be actively engaged to have the effective mass prevention control. Now, after all these efforts, we need to foster good habits which can sustain. Based on the consultation and the solicitation of opinions from multiple parties, we have the following suggestions. First, a good healthy dietary habit, separate plate dining, and refuse the use of exotic game meat, no smoking, and no waste. Reduce the intake of salt, edible oil, and sugar. Second, good habit of health, social distancing, wear masks when necessary, pay special attention to respiratory tract ceremony. And third, good healthy habits in frequent hand washing, hand hygiene, regular sweep up in families to ensure a good and clean indoor environment, participate in the organizations and the communities' efforts in sweeping up and sanitation. It is our hope that COVID-19 response can enable each Chinese to understand that individuals are the first person to be accountable for their own health. We should pay attention to our own health and contribute to the safeguarding of health of others. All these have been the persistent theme of Patriotic Health Campaign. Thank you. I'd like to thank all the guest speakers for taking questions on the topic of conducting the Patriotic Health Campaign and the promoting of environmental sanitation in rural and urban areas. Tomorrow we'll focus on law-based prevention and control of imported risks. We will have NHC, GACC, NIM, and NIA, and the Civil Aviation Administration officials to take questions. With that, we conclude today's press conference. Thank you.